So I've got a thumbs up from Beth. So welcome everybody to our Q Visits webinar. Really delighted you can join us on a Friday afternoon at lunchtime on a really nice day, but it feels like we're still in the middle of winter, I think, with the temperature. So thank you so much for coming. This is the second in a series of 3 webinars that we're running. Last month we did a webinar around some of the learning that we have got from the Q Visits around relational aspects of improvement, and today we're looking at how you deliver and develop effective improvement. So I'm hoping you're all in the right place at the right time. So thank you so much for coming along. So I'll introduce us all. My name's Emma. I'm a provider of the Q Visits program. So if you did come along to a Q Visit with us, then you will have met me at some point. And if you haven't, just a little background on me. I'm a Q member and I work independently in improvement, but have always worked in health and social care, most recently with Portsmouth Hospital. So keen improver myself, as well as taking people to visits. And then today we're going to have Pete Dudgeon, who's my colleague. He's waving at you, which is great. So he'll be taking part of the webinar. And then we're absolutely delighted in the 2 guests that we've got who are going to help us along our way. So we're delighted to be joined by Professor John Clarkson from Cambridge University. And also Steve Harrison, who's Deputy Director from Sheffield Hospital, Teaching Hospitals. They can introduce themselves a lot more later on in the webinar, but just to say that they're here as former hosts of Q Visits and also as absolute fonts of knowledge when it comes to improvement and how we pick up best practice and how we develop that across our organisations. So absolutely super delighted that they're here as well. So you'll hear from them shortly. So I just want to go through a little bit of housekeeping. So in terms of running this session, we'll keep you on mute while we present the core material, but we'll take you back off mute when we can chat and discuss. We'd like a little bit of interaction today if we can. Our chat bar is open all the way through, so if you want to say hi, say hello to someone you know, post a question, whatever, please use the chat there. What we're going to do is present some core material, and so we'll open up for questions after that. If you'd like to speak to us, then please do, and raise your hand, and that you do that using the Zoom bar. So there's a hand icon that will come up, or you can wave at us madly if you like, but we might not see that, but we'll keep looking. Do that, post in the chair. Both myself and Pete are watching all the time, so if there's something you've put in, like a key question, then we'll pick that up. And don't worry if your tech fails. So you'll see that we're recording, and we started recording right now. So we'll record the whole session, and we'll also save the chat as well. So we've got those 2 things running at the same time. If you want to tweet, we love a bit of tweeting. So sorry, Pete. Yes, so we love a bit of tweeting. Use hashtag Q Visits if you can, and definitely tag the Q community. And don't worry if anybody interrupts, that's fine. We're all used to that now, aren't we? We've had like a year of all sorts of bizarre things going on. So if the dog barks or the window cleaner comes or the dustbin man, that's what always happens to me. That's fine. We can all cope with that. Okay, so that's how we're running. So just in terms of the way the session will run, Pete, if you can show us the slide. Okay. So we've got a fairly regular format that we're using for each webinar. So we'll do a little bit of welcome and introduction now, a little bit of an overview of what Q Visits are for those who don't know what they are, or those who need a reminder. We'll cover some of our core learning that we've got from visiting over 20 places with the Q community. We'll ask you a bit about your experience, if that's okay. And we're definitely going to bring the hosts, Steve and John, in to share some of their knowledge, wisdom, whatever, with you. So please feel free to pick their brains. That's what they're here for. We'll ask you again to sort of get together with other Q members to think about Is there something important here? Is there something I could take away? So what? Is there anything next I could do with it? And then we'll talk to you about the next webinar that's coming in next month, and also pick up any views from you about how you found this webinar and the experience and everything. So that's where we are so far. So we're going to do a little bit, as you might expect, a little bit of our interaction between us, just to get us going and just to get us using some of the things that are on Zoom. So just for a bit of fun, you're probably all fed up of these check-in scales, but we'll have another go anyway. I found one that I hadn't used yet. So this little one, on this scale of art, how are you feeling? And what we're going to ask you to do is to use the Annotate function. So if you haven't used this before, it's a nice little function that you've got. Can I go back one slide, please, Pete?
Yeah, it's got a mind of its own.
I feel like Chris Whitty. Next slide, please. Yeah, okay, so Annotate, if you've not used Annotate before, if you use, oh, somebody's already there. If you go to the top of your screen, you'll see a view options. And if you click down on that, it allows you to find an annotate, and you can have a heart or a star or a tick or something like that. And so in terms of picking how you're feeling art-wise today, have a go and see if you could annotate on the slide. There's a nice few 8s. I like that. That's a lovely picture, isn't it? Oh, fantastic. Oh, it's great to see loads of people having a little go. Yeah, right mixed bag. I like this art scale because it makes you sort of think, oh yeah, how am I feeling? You can feel a bit weird if you like. That's fine. Great. Lovely. So well done for using that. So we're going to use the Annotate function again. So if you clear your Annotate, and we'll go to the next slide, Pete. So if you can take your markers off, what we would love you to do is, if you can, testing your geography skills, see if you can annotate on this map of Great Britain where you're from. Super. So I am in deepest, darkest Wiltshire at the moment, and I can already see some little stars and blobs that are near me. So that's super. Who have I got near me? Is it Fiona? I think I've got near me. See, Anna's on. Hello, Anna. Lovely to see you. Great. Wow, we've got people from all over the place. All right down in Cornwall, all the way up in the north. Oh, absolutely fantastic. So spot where people are, and there might be a Q member that you haven't yet met that's living nearby you. Okay, so thanks for doing that. And also, if you have been on a Q visit, can you use the chat function now to tell us, where did you go? Anybody been anywhere? Anyone been on a Q visit? Well, yes, John, you have been to Cambridge. Thank you. You hosted it. Anyone else? Oh, Fiona, yes, went to HMRC in Newcastle. Hello, Fiona. Fantastic. That was a good visit. I enjoyed that one. Anyone else? Unipart, Leslie. Oh, hello, Leslie. Lovely to see you too. Fantastic. Oh, Martin, NHS Britain Transport. That was in Bristol. Thomas, yep. Hello, nice to see you again. Oh, there's some real familiar faces here. Absolutely super. Okay, well, that is great to hear that there's some that have been on some visits, and then there's obviously some people who haven't. So that's great. There's loads we can share there. We'll share you some of our learning. And we'll also give you a chance to sort of share anything you've got yourself. So can I have the next slide, please, Pete? Is that right?
Yeah, it's frozen up a little bit on my screen, so I might have to come out and reshare. So it takes a little bit of time. Oh,
we got tech problems already. Yeah. So what we are going to do really early on now is we are going to put you into a breakout room to meet some of the Q members that are on the call with us. And what we like you to do is in that little breakout is to just have a little quick chat with each other, introduce yourselves, quick chat. Have you ever been to another organisation, whether it's a Q visit or it's another neighbouring trust, or have you been to a private sector, something like that? Have you been anywhere else? And if you have, what did you take away from it that you think might be of interest to people within your breakout group? So I think Beth is going to put that question in the chat. So she's saying, when you get into the rooms, introduce yourself alphabetically, and then just see if you can have a quick chat about some of the things you might have learned or seen by going to visit somewhere else. And have you any places that you have a dying wish to absolutely go and see, and you think, oh, if only we could have a Q visit there, then let us know as well. So Beth, if you're all right, can you put us into the breakout rooms, please? Thank you. Who have I got?
I think some people are still chatting away, but we're certainly getting there.
Isn't that a super sign? I'm glad you all have had a chance to. I'm taking the opportunity now to have a look at who's online. It's lovely to see some people I recognise. So hello to those that I do recognise, and lovely to see some names that I know but I haven't yet met. So even better. So we are not going to do this as in feedback from each group. What we'd like is that if there's any little nuggets or anything you'd like to share at this moment, whack it in the chat and we'll just have a quick fire share of any key things. So it was nice on our chat to have a little talk about some of the things that we learned from other people. Especially during this last year, and being able to not sort of reinvent the wheel, and being able to sort of pick up good things quickly from each other. So Steve's had a good conversation about quality built into the process, I assume. Yeah. Ah, nice. That's nice to know, Fiona. You'd like some more. That's brilliant. Yeah, and you, Tom. Fantastic. Yeah, I think we all felt that there was a massive value in seeing how other people did things and then reflecting on your own approach. Okay, so I'm going to move us on now because Pete's got plenty to share with us. So Pete, are you ready to pick up? Pete?
Yep, I certainly am. If I can get the technology working, it's been all over the place today.
Oh my goodness.
So what I'm going to do is I'm going to put this in presenter mode and see if it will work. That's where it fell down last time, particularly when I tried to do the annotate bit. So here we go. Wish me luck, everybody. So I just want to spend a few minutes talking about just an overview of Q visits we've been on. You'll see from the logos that there's too many to describe. Just to give you a sense, over 200 people have visited. We've had 25 organisations, probably slightly more than that. And we've been seeing concepts like lean, agile, vision inquiry, experience-based co-design, engineering better care, behavioural insights, relational leadership, agile microsystems, and many more. So you can see we've taken quite a broad view of the topics, and in some instances we've gone to an organisation that's sharing their organisational wide view, and in others we've gone and done a deep dive in one particular concept. So a real mixture. What I'm going to give you as we go forward is an overview of how we've broken down the insights coming from those visits, and then specifically focused in on today's topic around improvement, and just highlight some of the things that we've seen. As ever, this is only going to be a taster because some of these organisations have been doing this for decades. So when you put all the learning together, there's huge amounts to know and appreciate. So please be curious with our host later on, and with myself at the end of this session too. So, as Emma described earlier on, when we looked at all the insights we've gained from all the visits, we pulled these, and they seem to be in really three broad themes of relationships, of ways to improve processes and systems, and also organisation, which is more about how you set up your organisation so that improvement can work and flourish and people are engaged. So we've split those down, and under improve, we pulled out some core themes around exploring the environment, which I'll talk about. So how do you understand the environment for the improvement you're going to undertake and the importance of that context? How do you design well, given that context that you've explored, and how you then deliver sustainable solutions within that? So those are the aspects we're going to be talking about. So if we take one by one, exploring the environment. So what I would say is that we've put here not all of the visits, but the visits which resonated strongest for us under this theme. So we've done a bit excluding people. So this is definitely seen as the areas where we think we saw this most. So this the Sheffield Microsystem Academy, and we've got Accredited Advancing Quality Alliance, Northumbria, Prostate Cancer UK and Cambridge University. So that's what I'm going to be talking about in the next few minutes. And down on the bottom left, if you're wondering what that is, that's the big room picture that was shared with us from Sheffield. I'm sure Steve will talk about that a little bit later on, as much or little people want to know. So what did we see? If I can get my animation to work. Here we go. So the big room solution, which is an idea borrowed from Toyota, but is used very effectively in Sheffield to understand the whole context of the improvement and then manage the improvement process. It's used in complex situations rather than simple improvement contexts. They introduced something to us, a diagnostic approach called the 5 Ps, looking at patients, view the professional, service patterns, the process itself, and really defining the purpose. So doing that really upfront before embarking on any improvement cycles. In Aqua, they had a diagnostic approach that was similar in some ways, but had its own nuances. So they focused on staff engagement, culture, lived experience of people within the process, the informatics, how that's all processed. Interestingly, they always did financial mapping within that diagnostic process as well. And if we go to Northumbria, we saw experience-based co-design, where this is where we really focused on getting a balanced involvement of the staff and the patients through the whole design process, where before we even get into the improvement, we go and seek the views and experiences of both of those groups. So in a sort of different way, but a strong way, they really emphasized understanding what's going on currently without making any sort of judgments about design. We looked at the appreciative inquiry within Prostate Cancer UK, and that's where they go through a process of saying, you know, what's working well within this environment before they get into improvement. Within Cambridge, in terms of that early piece, I'm sure John will say an awful lot more about later, they really took a lot of time to define their systems. But just to say a little bit more of those things, you know, what are the sort of things you might have seen in a big room in Sheffield? Well, you'll see voice of the client, you'll see various models, metrics and macro planning, weekly planning, problem solving, which if you've got very good eyesight, you might be able to see some of those in that bottom left picture, but probably not. And what else do we see? Customers being an intrinsic part of the design team from the start. We saw that in an awful lot of organisations, really emphasising that. We saw this 5D process where you define, discover and dream. So this is the process that we go through within appreciative inquiry. So they'd spend quite a bit of time in this definition and discovery phase, asking, you know, what can we do within this dream phase before they get anywhere near design or delivery. And within Cambridge, when we're looking at systems, there were some key questions that came out right up front about the system that you're looking to improve. So who will use it? Where is it? What are the elements of it? Who are the stakeholders and what are the needs? And I've really emphasised that bottom part of what are the needs, because I think sometimes in improvements we focus on one particular outcome that we try to achieve and then say, how do we achieve that? Whereas Cambridge, we're really emphasising you can have multiple stakeholders with multiple needs that need to be incorporated in the design, and how do you go about doing that? So quite a lot on the explore side of things. Then in terms of getting into the design of it, lots of insights to draw from different organisations. So we picked up Agile with Maiden. So their approach was very much to have an understanding of the user, and they had a representative of the user on their design team. That was one key feature of their design process, many others too. In Cambridge, we were emphasising the double diamond approach. I don't know if you've come across that before, well worth looking up, that we really understand the need behind the problem before we understand the problem itself, and that's an iterative process that you can go back and forth on. At WPP, we focused on behavioural insights. So what they were focusing on is designing for each human characteristics in terms of biases, so the way we behave and how we understand people's biases, and how we can build that into the design to get the outcomes that we want. Then in places like Unipart, we saw things like principle-led design. What I mean by that is they designed as an organisation what their principles are. I've shared a few of them on the bottom left, for instance. We expect people to solve problems at their own level, or we build quality into our processes to avoid creating or passing on defects. So whenever somebody went to design a process, they had a rubber stamp as to one of those principles that they build into that design. And often working with in NHS organisations, I often feel that there's disagreements, but not a clear articulation of what is actually going to inform this design. You know, what are the principles that we're falling back on? In order to apply all those things like behavioural insights, I've just called that things on the right side, called the EAST model. You might want to have a look at doing that. In terms of Agile, their view was, it says fail fast. There's a stuff that's going to be working on frailty recently. It should say fail fast. So they were talking about learning quickly. And the reason I put user stories in there, that was quite common through a few visits, where we start to understand the user in more detail. And John may talk about personas a little bit later on. And it's about in terms of understanding the deep needs of the people that we're serving and what are the sorts of people we're designing for. And lastly, I'll just cover off sustainable solutions. This is about the delivery part of it, it's the actual implementation once we have the design. A few places to know is Health Improvement Scotland, Nissan, Unipart, and Bournemouth. There's a few things to say about there as well. So within Health Improvement Scotland, they've done a lot of work on quality management systems, well worth looking up. We do an awful lot of work in healthcare on quality improvement. Often we see that it's difficult to get quality improvement to land because some basic standards aren't in place, or there isn't a good, robust planning process in place, so they're really focusing on that. Places like Nissan, Unipart and others really focus on standard operating procedures being at the heart of their work, and that they're essential if we're going to make improvements stick. I remember one person in Nissan saying asking how many processes did they have, and the woman just sort of huffed and went, "Oh, I don't know, thousands." So they have really tight control of all the processes. And one thing that we looked at in Bournemouth, it's worth noting, is something called one-page quality control. So they basically had their processes, how it was running, the reasons for not running to process expectations, what we're going to do about those reasons, and tracking those reasons over time. So they had that all neatly laid out in one page for their post-improvement sort of monitoring. And just see if I get a look. So then the last thing to mention, I've not mentioned before, is that in Unipart they had this thing called workplace audit. It was not an audit like we would know, but it was more of like a supportive assessment of a workplace, whereby people in the process would flag up if there's any concerns in implementing anything, or people running to SOPs or any problem with the SOPs. And interestingly, they also audited the person in the hierarchy above them to check whether they'd done their audit correctly, and then they would put a mark on the board if they hadn't. With interesting dynamics there. And the last thing is we saw is this forcing function scale. I won't go through all the detail of, but just to say that the organisations that were doing long-term sustained improvement well were making sure that the processes were built robustly so that they actually couldn't go wrong, rather than relying on necessarily just the standards to make sure they didn't go wrong. So just a quick time check. Have we got time, Emma, for any questions, or should we move on? We've got a bit of time for questions? 1 minute, great. So I rattled through a lot there about exploring, about designing, and about implementation. Are there any questions before we move on? Any questions would be great, and any observations people want to make as well. Okay. How are we doing timing wise, Emma? move on to the next section.
There's a little comment from Tom about confusion between policy, process and procedure. Tom, do you want to unmute for a minute and tell us what you mean?
Yeah, policy, process and procedure are all different aspects of what we do. And I added another comment that SOPs are usually a bit of each all thrown into one. And it makes it very, very difficult to translate the SOP into what you're actually doing at work.
Mm.
Yeah, I agree. I was asked to review a policy once, and when I picked it up, it was a mixture of all those three things.
Yeah.
Absolutely. So defining those and disaggregating those, I think, is important, but also having an expectation, because at the minute that people have an expectation there's going to be a policy in place, but not necessarily there's standard operating procedures in place. So then because of that expectation, people tend to pour everything into one document. So they do need to be disaggregated. Yeah.
Got a great question from Anna. Thanks, Anna. What did we notice that people in the NHS were most interested in when visiting other industries? That's a great question. We just had a quick chat in our breakout room. And I would say, you can add in, Pete, from my point of view, the thing that most impressed people from the NHS in other industries was the focus on staff in other industries and how they were bothered about people's well-being, about people's interests and their skills and their development of improvement, and how even going to quite hard places like Jaguar Land Rover or HMRC, or places where you really focused on function and perhaps production or bureaucracy, that what really came over through the visit was how interested they were in their staff's own development and their staff's well-being as being essential to their improvement. Anything you would add, Pete, from your point of view?
Yeah, so I'd say that absolutely, and a focus on processes and people owning the improvement of their own processes, but to a shared end, which was to serve people they would call their customers, the people they're serving. So always with that shared focus. So yeah, I agree with you. I'll just add that. Yeah.
Okay, so Pete, I think there's loads of information you've just thrown at us there, and I bet most people are fairly stunned with the amount. So you will be able to see these slides again, but also to say that quite a lot of the visits were written up onto the Q website and also were recorded via Twitter. So if you ever want to search hashtag Q visits, you'd see the live feed that we got from our visits. But also, if you look on the Q website, you'll see each individual visit and what we got from that. So what we've had to do is to put everything together, haven't we, Pete? And try and bring out the themes. But as you can imagine, a whole day's visit to somewhere gives you so much more information that you can't possibly put it all into one. So I think that's a good point for us to move on to our hosts, because they could give us a little bit more of an insight into the visits that they hosted. So I want to say hello to Pete and Steve, and if Pete, if you can stop sharing your screen, we can see them. So where's John and Steve? Fantastic. So I'm going to ask each of you to introduce yourselves to the group and say a little bit about the visit that you hosted. And while they're doing that, if people can have a think, are there any questions they'd like to ask our two hosts? And if there isn't, I'll kick off with one and then see if people have got further ones to add. So I'm going to start with Steve. Do you want to just tell us who you are and what you did with the Q community quite some time ago now?
Yeah, hello. Yeah, hi. So yeah, Steve Harrison. I'm Deputy Director of Organisational Development at Sheffield Teaching Hospitals, and I work in a reasonably large organisational development team, and the bit that I own is building capability for leadership and quality improvement. And the Q visit for in Sheffield was a number of years ago. I think we hosted it at Sheffield Hallam University, And the aim of that was really to share a number of our kind of ways of working and things that were emerging that were helpful in terms of making improvements in healthcare. And I suppose there were three things that we shared on that day. One was really an overview of the approach that we were taking, which is basically something that you might describe as microsystem coaching, which involves understanding the system, involving people at the front line, having a structure for understanding the system and making changes, and paying attention to the relational aspects of improvement as well as the technical. So I suppose that was the kind of the overview approach. And we had a couple of, I suppose, guest people who also spoke on that day. Margie Godfrey, who works in the US, who helped create the sort of microsystem approach, talked to us a lot about leadership and team coaching, and how actually bringing people together into a space and helping them make improvements as a collaborative exercise, and coaching them through that process was really important. And then Tom Downs, who works here at Sheffield with me, he's the clinical lead in my department, talked about the big room and our flow coaching approach, which is about understanding a care pathway from a patient almost presenting to maybe a GP with an issue, right through to their kind of treatment and rehabilitation or whatever, understanding the whole pathway, and then bringing stakeholders together with patients and system understanding into something called a big room, which is again a structure, not only understanding the system as Pete described, but also treating that system by a kind of an iterative approach to overcome the complexity of the system and build the relationships, which we've since rolled into a national programme, again supported by the Health Foundation, called the Flow Coaching Academy, where we're working with colleagues across the country. Some of them are on this call, to use that approach in their organisations to make improvements for patients. So that, in a nutshell, was kind of what the Q visit was about.
Thanks, Steve. Well done for summarising that so quickly. And John, would you like to give us a little introduction to yourself and your team, and what we learned when we came to Cambridge that day a number of years ago, I think?
I'm John Clarkson. I'm a Professor of Engineering Design at the University of Cambridge, and I'm an engineer. That's probably the most important thing you need to know about me. And I guess it was about 6 years ago, the Royal Academy of Engineering asked me to chair a working group to look at how we might define what a systems approach would look like for health and care improvement. And by the end of 2017, we published something called Engineering Better Care. And it was a set of perspectives of how you might look at health and care improvement through the lenses of people, systems, design, and risk. And this was a reaction against the system engineering mindset, which was a very carefully defined, tightly coupled, holistic view of how engineers did systems engineering, but almost unintelligible unless you grow up in that world. So we took a step back and said, well, what are these perspectives? And we expressed them in the form of questions. So a simple set of questions that would help us understand those perspectives of people, and Peter's shown some of those questions: systems, design, and risk. So when it came to the visit to Cambridge, we invited people in, and we had our co-collaborators, Pete and Emma, who'd helped us through the work at the Academy defining those questions, and John Dean from the Royal College of Physicians. And we talked through, well, what is this about? And then we ran a set of parallel workshops, one in each of the areas of systems, design, and risk. And what we did is we told engineering stories that unpacked a little bit why these areas were important. And then we ran exercises with people, so they got sort of first-hand experience of, well, how might they answer these questions? And it's a bit like being in a parallel universe listening to Steve, because it's about getting the right people in the room. It's about that fundamental difference between the patient journey and the clinician pathway, and really understand the difference and the important difference between the two. It's about a significant emphasis on problem seeking before you get into problem solving, but acknowledging they come as a matched pair. And fundamentally, I've realized that sort of 45 years of engineering comes down to two questions. How can we do it better? And what could possibly go wrong? And it's that second question that starts to bring in the engineering mindset, where we try and stress test things before we put them in practice. We don't build bridges and wait and see which ones fall down to know which ones we should build again. We try and make sure the ones we build stay up. But it's that balance, and everything we've done in Engineering Better Care is simple questions. You don't have to be an engineer to ask the question or to answer it. You don't have to be an engineer to know what tools you might use to help you answer the questions. So since that point, we spent 2 years translating the what of Engineering Better Care into the how of a toolkit we've called Improving Improvement. And it's a much more pragmatic sense of, well, if these are the questions, how do I answer them? And we put an element of process in there, and process is hugely important when we're trying to do improvement. It's how do we get from where we are now to something measurably better? And the process would be, how do we understand the context, define the problem, develop the solution, collect the evidence, manage the case or make the case for change, manage the plan, and fundamentally, how do we agree the scope of what we're doing? So all those questions we've been asking are wrapped around a process. And increasingly, we're out there training clinicians, improvers, care providers. And I run 2 working groups at the Academy. One, still the same working group on systems engineering and healthcare. How do we continue to develop this mindset, this offering of a systems approach, which I should say wraps around anything else that you might have. It wraps around the IHI model, it wraps around lean, it wraps around any existing approach to improvement, adds perspectives and questions to it. But I also now chair a working group in the Academy about systems approaches in policy. And it's really interesting that the same questions, the same mindset we apply for policymakers in government. It's the same challenge. How do you bring a systems approach to that? We use the same engineering stories to say, well, this is why we as engineers think this might be valuable. And the only thing we do different is we switch out healthcare stories to help clinicians and care providers and improvers engage with policy stories. But otherwise, all the same exercises, the same mindset. And we found it incredibly useful and engaging with policymakers, managers, improvers. We're now setting up a master's program in the university to provide part-time master's offerings in this space because we think it's so important. But we want to bring together fully paid up clinicians, engineers, med tech providers, right across the board who would all come together as a community to learn together. And some would take the learning back into the hospital, some into medical technology development, some into policy making. But the key is it's all about the process. And within that, how do we drive the process with a simple set of questions and a simple structure to help people understand what questions to ask when?
I'm going to ask you to pause there, John, if that's okay. In the chat, if there's any questions you want to ask Steve and John, fire away and I'll either myself or Pete will pick them up. Or stick your hand up, as I said before, if you're able to use the thing, and we'll unmute you so you can ask a question. But while you're having a think, then I'm going to give them a question to ponder on. So John and Steve, what do you think, if you were asked to pin your colours to a mast, what do you think are the vital ingredients to developing and delivering really effective improvement in an organisation? I'm happy for, who'd like to go first? Steve?
Yes. So I'll go first. Give John a minute to think. So I think we've touched on quite a few of these, but I suppose if I had to pick on 3, and there's lots of lenses you could look at this from. There's like a leadership lens, there's like a management system lens, but I'm going to take more of a kind of the sort of ingredients to create a sort of a successful improvement attempt, I suppose, at a pathway or at a team level or something like that. I think there's kind of 3 things. There's first that it needs a method, and John's just talked about that quite at length, which is we've got a flow roadmap, a microsystem improvement ramp, whatever you want to call it, but it needs a method, and that method can't be just about solving the solution. It needs to understand the problem and identify what are we trying to achieve here, what are the issues, and take a slightly step back, broader view before you kind of jump into solution mode. So I suppose that's the first thing. And then a method for implementation that probably involves a degree of iteration and sort of starting small, so that you can almost answer the question that John just posed: what could possibly go wrong? Well, if you test it out in an ever increasing way in the real world, then you'll find out. So learning from failure type approach, and then some sort of method for sustainability, I think, on there as well, whether that's making sure that there's a data model that sort of monitors the process that you want to improve, so that you know over time whether that is being sustained, so some sort of sustainability. So methods the first thing. There's a number of ways of doing that. I could sell the flow approach, but I won't. And the second that I think is really important, that's often missing from improvement approaches, is a structure to effectively engage people in the process. So that's why we use these microsystem meetings, big rooms, that have kind of a structure to bring people together and take them along that journey, so that we don't allow that to just happen by chance. We kind of build it into work, and we have a process for it to happen, and including that, effective ways of running meetings and so on, things that we forget about, that we expect people to just be able to do. So there's something there about structure to run a meeting effectively for improvements, a structure to involve people. And that doesn't necessarily have to all be all about meetings either. We've been using social media platforms like Workplace, for example, use Teams to create asynchronous learning, where people can use, you know, chat functions and document sharing and whatnot to overcome problems too. So it's not all about the meeting, but it needs a structure. And then my third area, I would say, vital ingredient, is the skills to deal with the relational as well as the technical. And because the technical is important, but then you may well get people taking positions. And what I mean by that is that why would I want to change? Why would I want to get involved in this, etc. Or actually barriers created by relational issues. And therefore, some coaching approaches to help reframe problems, help people seek solutions and overcome sort of barriers, understand people's assumptions that they make, and build those relationships are really key. So there's something about the kind of paying attention to the relational as well as the technical. Those are my three vital ingredients. I would put leadership as well, and a management system to enable your improvement on top of those. But within the improvement world, that's what I would say.
Fantastic, Steve. Thank you. So, John, I'm going to ask you to be brief on your answer to me, because there's a couple more questions that have come in, and I want to make sure that some of the Q members get to ask their questions too. So, any quick thoughts from you, John, as to sort of vital ingredients that you couldn't do without?
What he said.
I'm
not going to repeat anything because I agree with everything, but just to add a couple of things quickly. Improve if necessary, where necessary, not just because you can. That's the first point. Second would be agree the scope. Look at different stakeholder needs, but make the difficult decisions early as to which of those needs are most important and which ones you cannot and should not look at that point, and agree that, so those difficult conversations happen early. We have a canvas that captures everything on one piece of paper, every piece of that process about the context, the problem, the solution. What do we know at a glance that we can all sign up to and agree, and it's a live document? And the last thing is critical thing about system boundaries. Be very fluid in your perspective of what system boundaries are. They're probably wider than you think. Let people dream before they are hindered by constraint. Let them dream and then come back to reality, and you're always in a better place. Fundamentally, though, think about how you delight the patient and the people providing for the patient. If you have that in mind, you will always end up in a better place.
Thanks, John. That's lovely. So we've got a question from Ambuj, which is, what measurement perspective were the metrics that you used to measure mindset change at an organisational level? And I'm wondering, Steve, whether that's probably helpful for you to answer, thinking of the MCA and what you've done across Sheffield.
Yeah, so I think this is a really good question, actually. And of course, you can measure lots of processes, and we've done that, you know, in terms of number of people we've trained, number of projects that have happened, number of case studies. There's all that kind of stuff that you can start to get a sense. And also, I suppose there are other things that you can start to look at, you know, sort of more harder measures like, you know, kind of what's going on around, you know, kind of actual improvements, lengths of stay and so on that have resulted on the back of that can show that people are kind of working differently. But I think in a way, this is like a long journey. And I think and it's not a measure in a way, but it is and a really important measure for me, and I'm going to perhaps be surprised, is the number of people in senior leadership positions in our organisation who have led or have been through our programmes. And that's increased a lot over the years, which is changing the culture. So for me, that's almost the most important measure, because that's what's setting the tone. So thing about, now we've got a medical director who's been through our programmes, and we've got several clinical directors who've actively led improvement work at the front line. That's what changes. That's what changes the conversation. Operations directors and so on. So there's something about targeting it into your talent and your progression within the organisation. Because what we've not had in Sheffield, and there's a question later about kind of boards and stuff like that, is a kind of Damascene moment by somebody and that has said, we're going to be Unipart and we're suddenly going to weave this right through the organisation. So it's actually been a long journey of adaptive moves to try and embed improvement into the organisation. And that's the measure I take as success, that leaders are getting into leadership positions because of leading this sort of work.
Okay, thanks, Steve. I won't ask you Alan's question because I think it links to what you've just said. But if you have a look in the chat, there's a question from Alan that you might be able to answer a little bit more directly around trust, working with trust boards. But I'm just thinking, before we move on, Tom's raised a question that I think maybe John might be able to give some comment on, which is around, is an SOP the best way of defining an NHS process? What do you think from an engineering perspective, John?
Well, I used to write SOPs when I worked in technology consulting. And I think if you use them to capture the things that must happen, but leave flexibility for the things that need to be adapted and used by people, they can have value. If they overprescribe what's going on, they're destructive. So I think it's horses for courses. It is about principle. It may be about process. Do it this way because it takes risk out of what you're trying to deliver. That would be useful. But then said, if the people you want to communicate with respond to SOPs and they like an SOP to provide a clarity about what you expect of them, then it may be the right way to communicate. So it's about understanding the situation as to whether and on what level that's the best way to communicate.
Thanks very much, John. So I'm going to move us on. There's loads of resources that both John and Steve have made available, which we've put in the chat, but we'll also add to. So if you want to have a look at those, if you want to contact us as well, we can share more. But we're trying to condense huge amounts of learning and information in a very short period of time. But please feel free to ask us all or contact us for anything else. So we're going to move us on, just a chance for you to go back into your breakout rooms to see if there's anything that's occurred to you from what you've heard. And I think Beth is going to put it in the chat, what we'd like you to just ask yourselves really is there anything that has made you stop and have a think today? Anything that you'd like to find out more about, or anything that you might want to take away and put into your organisation? So I'm going to ask Beth again to put us in our breakout rooms. I noticed a couple of people have had to leave, but that's no problem. So if you've got a gap, don't worry. But hopefully we've got enough to be able to have a quick chat before we come back together towards the end. Thanks, Beth.
I think we've got everybody back. So what we'd like to do now is just spend a few minutes listening to just a few feedback from a few of the groups, see if we can get some feedback. We won't get to everybody, but if there's anybody who would like to say something about what you ended up discussing within your groups, that'd be great. So I'll leave the floor open, and please unmute yourself and speak up. And if we don't get any volunteers, I'll kick off, but then I'll leave it for a few seconds. Does anybody want to feedback some of the areas that resonated mostly with them, or anything they thought was important to come out of those breakout groups? Okay, so Kathy, thank you. Yes,
that's all right. We just we had a conversation in our group. We really liked it. It kind of simplified it down really around improvements. What John said, how can we do it better? What could possibly go wrong? And almost if you just use that as a starting point to kick off, but also a grounding couple of sentences as well is really useful when you think you're starting to, you know, go out and out and out with your scope of just coming back in again. So I really liked that. I'm going to use that in some of my training, actually. I think it's really helpful.
That's great. Thank you, Kathy.
You got a hand up, Pete, from Hambridge.
Great, thank you. What's your hey, Hambridge? Is that a speak?
Hi, just to say, this is the first time I'm on this this forum, and I really thoroughly enjoyed. I think it has been an explosion of things. So it's going to be very different Friday and weekend. Thanks for sharing all those thoughts. I think it's really, really powerful. And I look forward to attending more of these going forward. Thank you so much.
Thanks very much. Thanks very much, Amber. So, anything that we'd like to say before we move on to next steps?
It may be some feedback from our group. We talked. I talked about being comfortable in the fog, which is a phrase I've used a few times, and I think it's being comfortable not quite knowing what the system is about, and it's complicated, it's complex, but being comfortable with just keep asking the questions. And I think I couple that with the observation I have that the teams we work with often fear the fog, and I think you need to become comfortable with it and make sure that when you emerge from the fog, you're facing in the right direction. And what I mean by that is you've got to solve the right problem, and you've got to solve it right. So trying to find, well, the teams we work with are generally very good at solving the problem, but less good at finding what the right problem is to solve, because it's a difficult process. So having that sense of leadership where you're comfortable leading people into the fog, keep asking the questions, keep being curious and inquisitive, capturing what you're learning, the fog does clear. And you find that people suddenly all collectively have learned something really important about what they're doing and what they should be doing next.
I really like the fog analogy. It's something that I use a lot, particularly when people are asking for a firm plan about what's going to happen in 4 months' time on a Tuesday. So it's a bit like driving in fog. You only see so far down the road, but you know you're going to get to your destination at some point. So anything else, okay, that struck us out of your breakout groups? Anything else that your conversation's focused on?
Just another comment on fog, really. We've moved on to a fog analogy. There's a chap here in Sheffield, Martin Wildman, who's done a lot of work on behaviour change and understanding kind of why people do what they do. And he talks a lot about the fog of war as a way of protecting you and thinking about kind of what goes wrong. Because apparently in the army, when they kind of plan to kind of attack or do whatever they do, any manoeuvre, basically they expect it to go wrong or change, because no plan survives engagement with the enemy, is apparently what he talks about. But I suppose what that means basically is that when you're designing to improve something, it's likely to go wrong, and actually you'll get more learning from that than if it goes right. So there's something about actually being comfortable that whatever you're testing, it's likely to go wrong, but you'll if it does. So then blame the plan and try something else rather than blame yourself. Just an anecdote about fog, I suppose.
Yeah. There's a slide you shared with us on Steve that I had in my mind as soon as you started talking about. It's certainly a powerful analogy. So I'm conscious of time. So what we're going to do is we're going to just spend a couple of moments thinking about the future. We had a good conversation in our group about what would be really nice to do going forward with the visits and how we can share some of the learning, and when we're allowed to visit properly again, how would that work? So any thoughts you have on that are really, really welcome. We appreciate your feedback. Just to let you know, we've got another webinar that's going to really focus on the organised side of this, so about how do you align improvements. We've started talking about that today. How do you engage the workforce, develop improvement cultures? That's what we're going to be really focusing on next time. Ian Smith, the head of North East Transformation System, will be with us. And also, we're going to have a representative from East London Foundation Trust. The name is just being confirmed at the moment, but we will have support from that organisation as well. So we're really pleased to be able to do that. Really pleased. So what we're going to do now is we're going to run a couple of things before I say my final hello and thank yous and get some feedback. We're just going to run a quick poll, another time to get engaged with some of the features of Zoom. So if we could run that poll and just run that poll on your screen, that'd be great.
We're at 100% on that now.
That's great. Thank you very much for taking the time to do that. Really good to get a quick visual sense of how people are feeling. And what we're going to do now, just before we close, just to inform the design of our next workshop, we're going to be asking you some feedback in the chat. We're just going to ask what went well and even better if. So what do you value from it, and any suggestions for the future? So I'll put that question again in the chat in a moment. Oh, it's done for me. Thank you very much. That's great. Thank you. So before we collect that, though, I just want to say a huge thank you to everybody who's attended today. Not least Steve Harrison and Professor John Clarkson from Cambridge, Steve from Sheffield. I really appreciate you spending the time to do this today. Yeah, can't express how pleased I am with the fact that you've agreed to do it, and your contribution today has been fantastic. So thanks very much. Everybody, I wish you well. If you could please put in the feedback, what went well, even better if, to give us a view for next time. That'd be fantastic. And as soon as you've done that, I'll say adios, goodbye, and hope you have a good weekend.